Good morning, good afternoon, good evening, depending where you are located. I see people coming from different places. Maine, let's see where else. Panama, Wisconsin. I'm from Panama, Boston, Philadelphia. Where else?
I saw Jerusalem go by.
Oh my goodness gracious, James, if you see more people that I don't see you, let me know because everybody's going by so fast.
Yeah.
Spain, this is wonderful. Alrighty. Okay, welcome everybody. We are so excited that you have joined us today for this webinar. We are delighted to welcome you today to our webinar titled Interpreter Tech Support in Remote Health Care Settings. My name is Analia, and I am the program manager and lead trainer here at Cross Cultural Communications, the only US training agency for medical and community interpreting, and also the creators of Blue Horizon, our online learning platform for our self-paced and live training programs. I will be your host for today's 1 hour webinar. Also, with us today, even though you cannot see him, but trust me, he's here, is my colleague, Andrew Hall, Cross-Cultural Communications Publications Manager. He's the coolest person, let me tell you. Andrew is managing the chat and will provide useful information in that area throughout the webinar. Now, before we begin, and as we are waiting for everyone to join us online, welcome everybody as you're chiming in. I would like to share with you about some upcoming trainings and in case that you're interested. The one that is just around the corner, June 24th, is going to be Symbols and Note-Taking, Advanced Strategies for Consecutive Interpreting. The next one, which is in July, TCII-TOT, that stands for Training of Trainers, it trains and it licenses interpreters to deliver the Community Interpreter International program. The summer cohort class is full. Hey, but we are accepting applications for the fall. And James here is going to be one of the trainers. So anyway, we're so excited and looking forward to that. Next, we have TRI, is the first comprehensive textbook in the field, and it explores how to perform over the phone, video, and remote simultaneous interpreting along with our TRIO a self-paced online training. So you can go to our website and learn more about it. Okay, let's get down to business, okay? The webinar today is about 40 to 45 minutes followed by 15 to 20-minute Q&A period during which you can ask our presenter, James, questions. During the webinar, please keep the Q&A feature open and use the Q&A to submit your questions for our presenter. For other comments or questions for us at Cross Cultural Communications, please use the chat feature instead. And if you want everybody to see your comments in the chat, please make sure the chat is set to everyone. Lastly, if you want to stay on after the presenter leaves at the end of the hour and you want to chat with Andrew and myself, we will be happy to answer any questions that you may have about cross-cultural communications and Blue Horizons. Just to remind everybody, this webinar has been approved for CE use. Please remember that 24 hours after the webinar, attendees will be emailed a link, okay, to download your certificate of attendance. It will go to the email that you sign in or register for this webinar. So please check your spam folder or junk folder if you don't find it easily. Certificates are only available for attendees of the live session of this webinar. And remember, they must be downloaded within 2 months of today's session. They won't be there after that. Now, without further ado, let's begin our webinar, Interpreter Tech Support in Remote Healthcare Settings. And I'm going to introduce our presenter, James Cech. James is currently a staff interpreter at Michigan Medicine, University of Michigan Health, and the owner and performing interpreter with Synergy on Stage. That sounds so much fun. He is a graduate of and formerly an instructor at Baker College Interpreter Training Program, and he earned his BA in Interpreting Studies for Madonna University. He maintains a private practice and specializes in medical, political, business, and entertainment interpreting. How much fun is that? Really, he also is interested in physical health and repetitive motion injuries. He has been a certified interpreter since 2010 and a licensed trainer of the Community Interpreter International since 2018. James, it's over to you.
Awesome, Analia. Thank you so much. Okay, I'm going to share my screen, get this presentation going. And I know it always sets it up as the very, very end. So there we go. Somehow Zoom doesn't like to communicate well. I think that there were a couple of things that I accidentally failed to include in my bio there because the persons that I'm used to presenting to, but my languages are American Sign Language and English. Those are the two languages that are my working languages as an interpreter. I've been with the University of Michigan Health for 7 years as a full-time. I'm a senior staff interpreter here, and I absolutely love working for this institution. And then I actually just changed the name of my company from Synergy on Stage to Stage Hands, kind of a clever play on words there, and definitely was well received by our community. But yeah, it's a lot of fun. For example, I was able to just send interpreters to the Janet Jackson concert that happened in Detroit. So I didn't personally get to go and interpret that one, but that's the type of thing that my company gets to staff interpreters for. I'm really honored to be here. I love working with cross-cultural communications. Not only do I train the Community Interpreter National, but as of last year, I'm a trainer of the trainers, which means I get to work with cohorts of people who will go then and train the Community Interpreter International in their communities. And I love all the work that cross-cultural communication does. So I'm honored to be here with you today. We don't have a lot of time, so let's go into it. I'll start off by saying, as we go through this presentation, please feel free to absorb all the information and send me back potentially a revised title because it's a working title and I'm not entirely sure that it captures everything I want to get to. So if you come up with a better title, by all means, send that in. We've been kind of looks like coming out the other end of the pandemic. I know here at the University of Michigan Health, the mask mandate has just been lifted for both staff and patients. And so it's a new environment again, where people are in person and there's no masks unless you are immunocompromised, have symptoms, or just prefer to wear one. And so as we look back over these last few years, you would think that because everything went to remote so quickly, and so much work was happening remotely, that everybody would kind of be an old hand at it at this point. And I found that that's actually just not true. As video appointments pop up in our system and we're able to join them, we use different programs in order to connect with people. Zoom is one of the main ones that our institution uses. And I connected recently to a patient. They had connected to an appointment. The provider wasn't there yet. I joined. I like to join early, make sure that my camera and my settings are accurate, that the patient can see me well, and gives me a little bit of a chance to feel settled. And they also feel confident because patients don't connect to remote appointments frequently. And so they want to make sure that they're doing it right and they're in the right place. And so we're going through all of that. And as I pop on the screen, this patient looks at me and gets very confused. And my first thought for a moment is, okay, maybe they don't need an interpreter. And so, that happens from time to time. So I start, signing with them. They're signing back. Turns out, yeah, they do. And they said, well, I find it interesting that you're an interpreter here for this appointment. I just got off 2 appointments and I didn't have an interpreter on screen. And I looked at our schedule and I thought, well, there was an interpreter scheduled to be there for your virtual appointment. I reached out to the interpreter who was scheduled and I said, did you join for this appointment? And I said, yeah, absolutely. I joined for that appointment. I was there. It was a 45-minute appointment. And I popped back. And what I realized happened was our interpreter joined after the doctor joined. And so because you have the patient and the provider in a Zoom meeting, and the way that the patient was connecting, they used speaker view. And speaker view only shows you one individual. And so they didn't realize that the interpreter had joined. And so they had this conversation as best they could with the provider, and they never even saw the sign language interpreter that was there, because Zoom features are audio triggered. And so seeing another person sign, motion's not going to do anything. It's not going to trigger anything. So we had this patient go through 2 whole appointments, had an interpreter, technically part of the appointment, but they never even saw them at all. And so these are the types of interactions that we have. These are the types of snafus, maybe we want to call it, that regularly happen, even still 3 years after we've made this entire shift to remote work. And so we're going to talk about that today. Just as an interpreter, how comfortable are we? Can we diagnose when things are starting to go off? Can we step in and make some quick adjustments on our own? Can we make sure to head them off before we get there? Or can we at least walk our clients and consumers through what they need to do to make sure that everything technologically is running as smoothly as possible and help make their experience so much better? So I want to say that we are not going to go into the interpreter features of each remote simultaneous interpreter platform. And the reason we're not going to do that is because actually I see there's so many people participating in the chat. Just do me a favor, in the chat box, type the different names of the remote simultaneous interpreting platforms that you connect to interpret. So just, I want to see a bunch of different company names pop up here. There are 556 participants, so there's going to be a bunch. Zoom, FaceTime, Interprify, AMN, Jabber, Google Meet, Kudos, LLS, Teams, okay, we're seeing more. WhatsApp, WebEx, Epic, Microsoft, Blue Jeans. Oh man, Blue Jeans. Love Blue Jeans. That's a throwback for me. Doximity, Language Line. So I can see that there are a couple of proprietary programs here. Awesome. If you're following along in the chat and you're just seeing video, the plethora of simultaneous interpreting platforms that are out there, there's no way in a 1-hour webinar that we would be able to comprehensively touch on all the things that you would need to know. So we're not going to go into the interpreter features because that's just not possible here. The other thing that I really don't want to touch on is the right kind of equipment, for 2 reasons. First and foremost is that you should get whatever you're comfortable with. You have your own budget, you have your own preferences, you have your own companies. And if you don't like something, just replace it, return it. A lot of companies these days will have that policy. And if you get something and it turns out, crap, I can't return it, well, then you have backup equipment. You know, you may not be your favorite, you may not like it, it may not be your workhorse, but at least it's something just in case something goes off. So remote simultaneous interpreting platforms and equipment can be the topic of another webinar in the future date if that's something you so choose to ask for. Instead, what we are going to talk about today are better remote interpreting habits, how you can, like I said, ward off a lot of the technical problems that are going to happen, or at least be prepared if you have to adapt and adjust to an unforeseen problem. And the other thing is, I've noticed over the last few years that a large chunk of me managing the flow of an encounter is troubleshooting technological problems. I'm not there just as the language specialist anymore, but I am also the one who uses these remote simultaneous interpreting platforms more than the providers and much, much more frequently than the patients. And so expecting them to feel comfortable and expecting them to know what's going on just makes it a very awkward experience. And so I just am very comfortable now stepping in. I have my scripts. I know exactly what I'm going to say when certain problems, because they happen pretty consistently, pop up. And I just walk our consumers through fixing it, and then we can go right back to the encounter, and I can go right back into my preferred, just being able to interpret between patient and provider. So those are our main 2 focuses for today. Hopefully that's good and everybody's locked in on that. When we say, and I'm just seeing a couple of things in the chat, they're called remote simultaneous interpreting platforms, even if your mode of interpreting is consecutive. we don't have a consecutive interpreting platform. Okay, so starting off with building habits. It starts when you turn on your equipment. What is the adage for all IT problems? If you're having an issue, turn it off and turn it back on, right? That literally is, reboot, unplug, plug it back in. So thinking about that from the fact that if technology really starts to either work or not work based on the power function, we're going to talk about 4 particular habits that you can develop, which is 1, check for updates every single day. In all honesty, even though iOS updates aren't happening, maybe I think almost at a monthly basis if you're using Apple iOS so far this year, but real regularly. Zoom and GoToMeeting just changed from GoToMeeting to GoTo. All apps are changing rapidly right now. So if you're not checking for updates on your devices regularly, you're going to find that you log into your system one day, you're prepared to go as normal, and then your computer wants to shut down because you haven't updated it in long enough, or it'll pop up and freeze everything. And it's just such an uncomfortable thing. Every single day, the moment you turn it on, check for updates, however that works. Secondly is log into your encounters early as possible. Frequently, what we'll find is if you're going to be potentially switching positions, I'll qualify that by saying, I am not in the same room every time I do remote interpreting. I am all over the health system, and we have some remote spaces. I also have spaces that I will go to when I'm in the main hospital campus. When I go to every single clinic that's under the University of Michigan Health, and if last minute video visit appointment pops up, I'm ready to go. And I can do that from whatever clinic I'm at. I know how to ask for a space. I know how to communicate that with staff there, even though I'm not a regular staff member of a clinic, and I can, get in. So because I have to be so flexible with my work and how I'm connecting, I'm always setting up and logging into, like I said, my main workhorse is Zoom. So I will log into Zoom separate from the appointment, make sure that I'm good, make sure that my angles are fine, make sure that I'm visible, and then I will log out and log into the video appointment. So if you're not doing that pretty regularly, or if you, are on the go, I've had to do some from my car before, private space, I'm pulled off, I'm safe, I'm not driving, and I have a couple pieces of equipment where I can set up different devices to be able to have a nice frame, and I know what it looks like. But every single environment that I'm in, I go in and I know how to feel comfortable, and I know where my technology is working for me. So check for updates every day. Make sure that you're positioning yourself regularly, especially if you new space. Do that outside of your appointment before logging in. And thirdly is make sure that if you're going to connect in a place that you're unfamiliar with, or you're not using an Ethernet cable, that you're testing your speeds. Have a way. Sometimes I will do it with a separate device, and I will check. Today, before this webinar, I made sure to log in early enough and work with Analia and Andrew and be sure that the sound was good, my speeds were good, nothing was blurry. Going through all the steps that you need to do. I'm just going to click through every single thing that I click through and know that, okay, it's working exactly as I expect it to work. That's a very important thing. And finally, and the thing that we're going to spend the most time here, is test your backup plan. For example, I am not presenting today on the device or in the room or with the equipment that I expected to present with today. But because I have backup plans for everything, it was really easy for me to shift and say, okay, the laptop that I prefer to present on, and I know what everything looks like, I don't have my power cable today because that got put into a different spot. Awesome. I'm going to shift gears. This is the computer that I'm going to use. These are the things that I have to log into. These are the things I need to download. This is the device I'm going to have next to me. I've got my iPad that backs up just in case something else happened. I have backup plans for every piece of technology. And that's what I test regularly. And it's not just like, oh yeah, I have a backup plan, I haven't needed it. I test my backup plan every single week, sometimes every few days, just to make sure. So we're not going to do too much more discussion on checking for updates. Just my encouragement, please build that habit in. literally every single day I check for updates, either through the apps themselves or through your iOS. Make sure you position yourself ahead of time, do it outside of any virtual encounter before you come on in, making sure that everything's comfortable. When you're testing your operating speeds, also go through and test every single function that you utilize in a remote platform. But now let's talk a bunch about backup plans. So backup plans are contingency plans. I have I've got actually more than this, but I started off with this on this slide with these three. If I can't connect for some reason, let's say it's the equipment. My regular connection is my primary iPad. That's how I connect remotely. It's just the way that our health information system and our remote video platform were integrated. Mobile was the way that it was designed to be connected to. And so I've just stuck with a mobile way of connecting. So I have a primary iPad that I connect to. If something goes awry, which, I mean, for example, one day I forgot my passcode. I changed it during a really busy day at the hospital when I had no virtual appointments. I didn't have any virtual appointments for a week. I had to connect last minute for a virtual visit. I had no idea what I had changed my passcode to. No clue. It was a brick, total brick to me. I'm like, okay, no problem. I can shift. I have my laptop. I know how to connect through the exact same pathways to get to this virtual encounter with my laptop. What happens if a day like today? Shoot, I forgot my laptop. I have absolutely no way to get in there. I have a second iPad, and that second iPad doesn't connect to the remote systems, but I know at that second iPad, I can reach out to one of my colleagues and I can say, hey, can you log into this virtual encounter? Can you give me the details? Send me that connection info, and I'll be able to connect to my second iPad. So I can utilize my team, but I'm still the interpreter as scheduled, and I'm able to get into that. And if that doesn't work, my phone. Now, as a sign language interpreter, phone is not preferred because the screen is so small. I would even rather, try to utilize my colleagues to help me get in with a separate device. But if I have to, I have the app downloaded on my phone. I know how to go through those same pathways to connect virtually. So I have 4 ways at any given time to connect to any of my virtual encounters. And those are things that I set up months ago, years ago in some cases. And I regularly go through all of the steps to make sure that what I'm used to doing to connect is always there. A good example of this is I had a colleague a couple of days ago who looked at an appointment and thought that it was at one of our remote clinics, drove all the way out to our remote clinic and realized, oh no, it's a virtual visit from a provider from that clinic, but no one's actually in that clinic. And so they were rushing around in that space. They didn't bring any backup equipment with them. They weren't expecting it. And they had no way to connect. I was alerted by the system that no interpreter was there. I reached out to that interpreter. I said, are you okay? They let me know the situation. I quickly switched over and I took over the appointment because I was ready to go. In my backpack, I have all of these things with me at all times. And it's just something that is really important to make sure that our continuity of care in terms of what our patients expect and how our providers need us to be there on time, all that can flow. So if the platform isn't working, and by this I mean Zoom is down one day, or no matter what, my device is fine, but I'm just not connecting to Zoom, or things are going wrong. We have institutional communication, and maybe you'll have this as well. Is there some way that you can find a backup plan? So I saw Teams go by, and the Teams chat has been utilized by some of our spoken language interpreters to say, okay, shoot, I know this person is here. We were connecting through our phone line. The phone line went down. Boom, we're on Teams. I know that provider's name. I connected with them and here we are. And so it's that quick adjustment on the fly. The institutional communication is a good way of doing that. Can you just pick up and call the phone? A lot of our remote interpreting, even if it's over the phone, is still based on software. And I know, for example, in our system, we have a primary software line and we have a secondary line in case the primary line is down for, I don't know, they're fixing it or something. But if all else fails, use the landline at some point. And I did see FaceTime go by. I saw WhatsApp go by. FaceTime is encrypted end to end. And I know that during the emergency exceptions during COVID, FaceTime was a viable way for people to use, or for doctors to use, to connect to their patients if something were to happen. I know that some things are phasing that out. But if where you are location-wise, for example, I had a doctor who was seeing a last-minute appointment or a last-minute add-on for a patient. And during that appointment, nobody was nearby. This clinic was really far away from where all of our interpreters were. And that provider was able to utilize their personal device to connect to our private and encrypted platform. But we were able to connect, so providers are willing to be just as flexible as we are. And the last thing, backup interpreter. So kind of going off of my example from yesterday where an interpreter wasn't able to connect and I reached out to them. But in this instance, once you know something is going off, reach out to a colleague right away. The longer we wait, the harder it is for our patients and our providers. Other things are network. Even networks at a giant institution like ours go down from time to time. So I know, for example, that there's a primary health network, there's a secondary health network, there's a primary educational network. None of these networks don't all go down at the same time. And so at any moment, if I go, everything's working fine, I always check that little symbol in the corner. Is my Wi-Fi up? Is even our desktops or I know, desktops would say a lot of those have Wi-Fi capabilities. So if your landline, or not your landline, if your Ethernet cable, all of a sudden your LAN, LAN, isn't working properly, can you switch to Wi-Fi? Do that as quickly as possible. Do you have a backup location? Do you have a backup, right? My point being is having contingency plans for all possible failure points is necessary. And don't hesitate. The moment that you see that something's going off, connection is bad. I know at the beginning of the webinar today, I saw a little thing pop up in the Q&A saying sound was a little bit off. I'm like, okay, is it me? Is it Analia? Is it somebody else? Just being really aware. And if that's indicative of a problem, I want to nip it in the bud right now and make sure that we get everything that we have to worked out. Everything doesn't go smoothly all the time. And I am going to share a video that happened Friday here at the hospital. So this is on YouTube. Anyone can see it. So hopefully we got the sound worked out for this one, I'm pretty sure. But notice me, I'm in the right-hand side.
Good afternoon. Welcome to the virtual town hall for June 9th. We all really appreciate your taking the time to be here today. I'd like to start off with a reflection about our recent medical school graduates. At last month's town hall, our Chief Academic Officer, Dr. Deb Weinstein, shared some facts about our recent graduates. This is a particular...
So I'm sure you noticed that I froze. And I will tell you that during those 9 seconds, which feel like a million seconds, I was immediately texting. I had a co-interpreter for that event. Immediately I saw that I froze. I texted the interpreter, said, hey, my screen is frozen. They wrote back and said, you don't look frozen to me. I don't think that they were looking at my particular screen. I think that they were just noticing that they could hear the meeting and they could see Dr. Runge. And I was like, nope, I'm pretty sure I'm frozen. So I'm immediately going into just you see my hands drop and then come back up real fast. But my eyes are on the screen so that the moment it does hopefully come back, I'm ready to go. And it doesn't look like anything happened on my end, but I'm freaking out during those 8 seconds. And I'm doing everything that I can to make sure you know that I'm frozen. If I stay frozen, are you ready to take over? 8 seconds wasn't too bad. And it was the introduction. Luckily, there were no issues for the whole rest of the meeting. But that's a high-level meeting. There are 40,000 people who connect to this. And so it's not something that you want to have go bad. So fortunately, everything clicked in. But the moment that I see a problem happening, I don't hesitate whatsoever. And I try to have that backup plan, because clicking on things or trying to figure that out, I have found usually doesn't solve the problem. So let's not spend too much time trying to solve a problem by just figuring it out, and go straight to a backup plan. So there are lots of different ways that you can set up your backup plan. I shared with you a few of mine. And hopefully then that will lead you to figuring out what extra equipment you can use, having different spaces, having colleagues that you can rely on, et cetera, et cetera. So backup plans are key. And the reason is that, again, beyond your stress and your ability to, on the fly, make sure that everything works out smoothly, is when you take away any problems from the interpreter end, everything goes better, and our consumers have the experience that they should have, which is direct communication in the way that they're trying to do it, and the interpreter doesn't become an issue that they have to focus on whatsoever. Okay, I'm going to take a sip of water. We'll go into our second objective. Okay. As I mentioned, our consumers, especially in healthcare settings, are either providers on this end and patients on this end. And as often as we would expect providers to connect, they don't always have the same level of experience and familiarity with these systems and platforms as we do. And our patients far, far less. And so for them, even though I've been interpreting for the same patients through remote appointments for 3 years, I still see some of the same patients having the same struggles and the same connection issues. And so what I've done is I have scripts. I know exactly what I'm going to say at different points for different problems that come up. And so let me share with you some of those problems that I come up, so you can create your own scripts as well. So it's either audio, software controls, where they're positioned. And what I mean positioning, I mean you have a provider and a patient who are together in the same room, and it's the interpreter who's remote. And just their familiarity with maybe the actual hardware, the physical equipment itself. So let's talk about audio. Devices don't have the same microphone capabilities. If you're using an iPad has what's called an omnidirectional microphone. It's picking up sound from 360 degrees around it, which I don't know. I don't even know what a sphere is, because 360 degrees is a circle, whatever that is, right? So it's picking up sound from the entire space. And so that's, I'm gonna leverage that later. So just keep that in mind, that iPads take sound from everywhere, all around it. Whereas laptops are a mixed bag. Some laptops might have a more full direction from which they're pulling sound, but there are a lot of laptops that are field of view. So if you're within my field of view, then the camera says, where if the sound is coming from anywhere on this grid, receive that sound. And what it is they're trying to prevent background noise from affecting communication, right? So it's an algorithm, it's a setting, the attempt is to make the sound clearer. But if you have 2-3 people crowding around a laptop, for example, the patient is a child and you've got mom and dad on either side. If you're finding that, like, wow, I really can't hear mom or dad, or I can't hear whomever guardian is on the side, if their face is cut off, that's why. The camera can't see them. And so the camera says whatever sound is coming from outside of that, it's not going to work out. Now, if you've got a headset, awesome. That's going to change things a bit. If you've got a microphone plugged in, that's going to change things too. So just be aware of how your consumers are connecting to the platform. And if there's something that feels a little off for them, sound is going to be one of those big issues for you. And so it's, for example, the script is, this is the interpreter speaking. I've noticed that the patients are not completely in the screen, and that can affect sound quality. If all persons can be visible on screen, that will help the interpreter. And then I make sure to say that in my other working language as well. All right. So audio issues is really important to pay attention to. What equipment or what device are they using to connect? When we talk about software, I'm going to try to keep this one brief. So my story to kick off this entire webinar, which was a patient and a provider had an entire 40-minute appointment and never realized that a sign language interpreter was there. Regularly, for me as a sign language interpreter, when I connect and the provider connects and the provider starts to talk, I will disappear. The reason that I'll disappear is because they're on Zoom, in particular on speaker view. And speaker view means whoever's talking is going to be big, and I'm gone. So what I have to do is I know now I have to start talking to make sure that I come up, and I'll explain right away, excuse me, doctor, I need to take a moment and explain how to get this patient to gallery view. And it's not just patients. Often I have providers who are like, oh, now I can't see all of you. Where did the patient go? Because now I can only see you. And so by talking them through one thing, I talk both parties through it. If they're on a phone, a swipe will work, or tapping the screen and getting those options. If they're on an iPad, a swipe won't work. They have to tap the screen, they have to tap the little icon. If they're using a desktop, the icons are in different places than if they're on an iPad. Get comfortable recognizing when you connect to a party. Just by the angle that you see, you can tell pretty much what device they're using to connect. Are they using a laptop, desktop, iPad, iPhone, right? If you pay attention to it, over time, you will become very familiar. And even if it means at the very end of the appointment, when all the parties are about to disconnect, quickly asking a question, how are you connecting to this appointment? What device were you using? Okay, great. So that's what it looks like in my mind. And so that way, when they're having problems, you know which device they're connecting on just by what you see, and then walking them through the steps. And even things that are simple. So like I've seen a lot of the proprietary platforms for like Language Line or AMN, and it's made to be as user-friendly as possible. And sometimes it can just be like, why can't we hear you? Well, do you know that sometimes old equipment from these companies came in on poles, and those poles were connected to external speakers. And those external speakers, if it's not been plugged in, won't have power. And so everybody will connect and they can hear you, but you can hear them, but they won't be able to hear you because the device is trying to run sound to an external speaker, and that external speaker is not on. So do they know how to turn it on? Do you have a whiteboard and pen ready? We had a lot of those, especially in the beginning. I had a whiteboard and marker ready to be able to write something, to hold it up to the camera, to walk them through until they could connect. Or just telling them where to unplug that cable through the audio jack to make sure that they could hear me. Again, this is where I can't go into every particular platform, but I will say get used to it and have a script. Excuse me, I'm going to walk everybody through to connect to gallery view. Pardon me for a moment. The patient is not able to see the interpreter because of, well, however you want to do it. I've kind of flexed that script as it needs to be. That's another good reason to connect early. Sometimes I can prevent that and saying, hey, I can see that you're on an iPad. If you tap the screen, you can see the little icon in the top right-hand corner. If you tap that and select gallery view, when the doctor joins, we're all going to be good, So things to keep in mind. Can you walk somebody through some of those points? When you're developing your scripts, come up with phrases that are easy to understand. What word would you use to describe this? Or what phrase would you use to describe this? Because this symbol is one that people have to go to a lot. Options. On Zoom, it says more, settings, 3 dots. Try out your phrases. 3 dots tends to be the one that people understand the easiest, right? That's the one I see kind of coming up the most. My wife called me earlier today. She needed help because there was a setting going off in the email, and I wanted to talk her through popping out the message screen so that she could type. And I said, you'll see 2 right angles that have an arrow that looks like it's coming out of it. Oh, yep, I see it. Boom, popped it out. And that's not what that button is called, but that's what it looks like, right? So figure out your phrases for all of the different options so that when you talk somebody through, it's smooth and convenient the first time. When I was mentioning that a lot of proprietary platforms and they give out equipment sometimes comes in actual hardware or forms that are a little more awkward. One thing that we do when we're connecting through an iPad and the iPad is on a mobile stand, when there's a patient and a provider in the same space and they're using an iPad, I will frequently get what you're seeing here, which is the provider and the patient want to be on screen together. And that's just uncomfortable and awkward for everybody. So what I'll do is I have my script right away. Hi, this is James. I'm the remote interpreter today. Could the providers who's speaking please stand directly behind the iPad so I can see the patient and hear you, and they can see both of us together. And then I immediately deliver that in sign language. I have my script. It's down. They move. I can hear them clearly. They are louder than any equipment beeping that's happening in the room. And the patient is immediately set up. And it's not something that I wait for anymore. It's the very first thing that I say. I just want to make sure that everybody's set and ready to go. I have what I need, and we can just then get on with the encounter. So with the bottom right as well, I mean, like you have these moments when you're trying to connect. It's know the environments that you will be the remote interpreter for, figure out what that layout is, and very clearly ask for what you need, and they're going to adjust. And then if a patient wants to say, oh, can we adjust it slightly, go with what they are asking for. But when you come in and say, based on my experience, this is the way that it needs to work out best in terms of spacing, everybody's going to go with that, and then slight adjustments can be made. But have that script ready and deliver that right away. And lastly, each of you will be familiar. Are they connecting on a landline? Are they connecting on a cordless phone? Are they trying to use a speakerphone? Are they trying to use a dual handset? Are they connecting to a laptop? Right. Again, if it's audio only, you should be able to have some familiarity. And so when somebody says, I'm having a really difficult time hearing you, are you on speakerphone? I don't know where speakerphone is. Oh, on the handset, it's in the bottom right-hand corner. It's the last button. Know what your equipment looks like, especially if you work for a company with proprietary equipment or proprietary platform. You need to be very familiar with what they're seeing so you can walk them through seamlessly. You become the expert in terms of a lot of the technology. And again, what that does is it makes it so that you can just get to the encounter. You are the person who uses this technology. You are the person who connects to people the most frequently. We might think, oh, I connect to this clinic all the time, or I interpret for this doctor all the time, or I see this patient very regularly. Yes, but that once a month, I don't know, maybe they come to the hospital a lot, once every 2 weeks that you see them, it pales in comparison to how many appointments you connect to every single day. You're the expert. And just stepping in and being able to guide everybody through makes the whole experience so much less stressful. And I think people are more keen to use over the phone interpreters, or more keen to utilize that, as opposed to going, oh, we'll just use a family member. Oh, we'll just write back and forth. Oh, we'll just figure it out. It's the technology that often leads to the frustration. So if you take away the technology as the barrier, then they're going to utilize the interpreter. The patient's going to get more, the provider's going to get more, and it's going to be a much better experience all around. I know it's a lot to cram into an hour. Hopefully those 4 habits that we have that I mentioned, checking for app updates, having a backup plan, walking through all your stuff, connecting early, etc. This is huge on your end to make sure that you are set and comfortable, and that you become the expert on one end. And then when you are in an encounter where troubleshooting needs to happen, you are the first person to just step in and say, I recognize the issue based on this visual cue, based on this sound cue, based on this problem that I'm hearing. Can you please try this? You may not have the answer every single time, but the fact that you do have an answer, the fact that you are trying to guide them through, that you're trying to grease the wheels of the experience, really is going to go a long, long way. So thanks for spending some time with us this morning into afternoon. I know Anali is going to pop back on, and she's been handling the Q&A for me. So hopefully I have a little bit more. That's my email at the top, just in case you have any specific questions that I might be able to answer to. My healthcare interpreting schedule is pretty full. So please give me a couple of days to respond if you do reach out.
Wow, what a wonderful presentation, James. Thank you so much for sharing your time and expertise with our audience. We're seeing many appreciative comments coming through the chat, people saying, this is awesome. Thanks, the technical aspect is part of our jobs. This is the reality. Thank you, thank you. This is so practical, great information. Thank you for sharing. So anyway, James, let's go and just ask you a few questions. One of those is there any advice on how to improve the Wi-Fi speed? I have tested it before, but if the speed is slow, there is not much way to get about it. So,
yeah, absolutely. Yeah. So yeah, who could? Starting to get into things I geek out about. The first thing that you can do. So let's talk about if you're in an environment where you're not in control of the router and you're not in control of the internet service provider, then really it's equipment. Your equipment is going to limit how quickly things run or how smooth your connection is. So if your equipment's starting to get older, that's something to really inform your employer. This is a necessary part of my job. If I want to work effectively, really my equipment has to be relatively new. And when I say relatively new, I mean like at U of M, we say your equipment is old after 2 years, period. I once was keeping an iPad alive for much longer than that, and I was babying it and everything was working out fine. One little problem happened. I gave it to my health information IT people, and they took it away from me. They didn't even give it back. I was like, oh gosh, come on, guys. I had so much on there. If you're working from a remote environment where it's from a home office and you're the one who's in control, paying more for speed is one thing, right? So I mean, it costs for sure, but that internet speed is crucial. But one thing to consider, and this is just something that I learned and kind of ran into a wall, was I was trying to switch providers because my internet speed was unsatisfactory. And the person who was the retention specialist said, well, it looks like your router's really old. We could just give you a new router and that would triple your speed. And I was like, why didn't you guys tell me this? They're like, well, you never asked. And I'm like, okay. So that kind of a thing. If you're using router technology or modem technology that you've just had and everything's been working fine, but now it's not, reach out to your equipment company, reach out to your internet provider, because they might have a plan to just replace your modem.
Thank you, James. Hey, James, could you please type on the chat your email address? Somebody just asked about it. And before I forget, if you could type that on the chat. And this is James Cech, by the way. Okay, so here comes, thank you so much for that. Here's the next question. Okay, these are great tips, but they aren't practical for a freelance spoken language interpreter. We're only paid for the time of the encounter and are often running from appointment to an appointment, carrying all of our equipment with us. Do you have tips for the most basic, portable, affordable equipment an interpreter should have?
Okay, I would like to politely disagree that these are practical tips, because as a freelance interpreter, which I do work outside of the hospital as a freelance interpreter, I take the time to make sure that I'm set and ready to go. That's part of me being able to provide a quality service when I do work for the variety of agencies that I work for. And Google reviews or Amazon reviews are honestly your best course of action in terms of coming up with, okay, I see that this, moderately priced headset got 4.7 stars from 5,000 people. It's probably going to work out pretty well. Or Amazon has a good return policy if you don't like it. But taking the time even though, yes, you're technically unpaid, right? You're not just saying, well, when I'm paid for an appointment, then I'm going to start working on all this stuff. Taking time that's unpaid for you really puts you in a position where if something goes wrong and you were the interpreter who fixed it because you took the time to really invest in understanding how this stuff goes, and then that's going to come back to the agency that hired you and said, wow, this interpreter was awesome. They were absolutely phenomenal because they just helped in all these different ways. That's reputation is key, especially here in Michigan. So I mean that's a big factor to consider.
Thank you, James. Here's another question. What can be done if we hear feedback like an audio issue?
Yeah, the main culprit for feedback is usually when you have two people in the same space who are trying to connect to a virtual appointment. And so I'll say, this is the interpreter speaking. I hear feedback from these devices. I assume you guys are within range of each other. One person needs to mute their audio and their microphone. So you need to hit mute on your computer, figuring out how to, on a Windows device, bottom right-hand side, click the volume thing, click mute. Whatever it is, I'm going to walk them through once I figure out what their device is. If it's on your end, like for example, if I start to hear feedback and I say, this is the interpreter, I hear feedback, and it's like, oh, no one else hears an echo. It's only on you. Awesome. One moment. I'm going to unplug my headset and plug it back in because that's usually what's going on, right? It's a power off, power on type of thing. If you can't actually leave the appointment, unplug and replug in as many things as you can. That frequently does it. And if it's, not on someone else's end and not your equipment, can you just handle it? That would be the other thing. I apologize for this, discomfort. Can we pursue?
Yeah, I love how practical James is. He's giving us tips that are easy to follow. I love it. Okay, here's another one. It says, I am aware you will not discuss equipment, but can you share what headphones you're using? So could you put it on the chat for us? No? Yes?
Sure. What? No, hold on. So remember how I said that I was adapting and that this is not my main space? These are Microsoft headphones. I have no idea beyond that. I just know that when I needed to get into a different space and adapt here, I tried to connect to this particular desktop, and the audio and the video was working, but the audio wasn't. So I went and quickly found headphones. I put them on. I tested them with Andrew and Analia. They worked. I mean, you could just use what works. I have no idea what these are. They're perfectly fine. They're fine for now. I'm impressed. I never expected to use them. I feel a little bit like should be the sports announcer for like NASCAR or a baseball game or something.
You're
like
natural.
that feels
James,
cool.
you are a natural. Okay, let me give you a more complex question, and I have a few more here for you. It says, hello, James. In case of sign language interpretation, what adjustment techniques would you advise when serving a meeting where you have different national SLI on a screen at the same time? The presenter screen is shared and the speaker spotlight now that there are no interpretation channel features that provide for video as it does for audio.
I don't know who asked this question, but this is a phenomenal question. And SLI, sign language interpreters, that's the acronym that they're using there. Yeah, so if you've got either international sign happening or you've got multiple nationalities who are signing, and so multiple people need to present ahead of time as best as you can, making sure that there's multi-pin. If they're like, for example, if you're using Zoom or some way to have multiple spotlights, that's the only way to really do it. When you have somebody connecting, that type of situation really sounds like a webinar where somebody's going to be connecting and they're just visual only. They're not a participant. They're not able to put their own video on. Their controls are going to be more limited. So what you want to have ahead of time is with the host or with the organizer of the event, going through and saying, what is your system? What accessibility features does your system have? And if in the moment, or you get there and you realize this conversation didn't happen and you don't have time to have it, figuring out who's the person who's the host. And when one interpreter is on, if there's a co-interpreter or a feed interpreter, that interpreter is reaching out to the host and saying, please spotlight, please spotlight, please spotlight. Just annoy the heck out of them until they spotlight some interpreter.
Great. Okay. James is the expert, okay? We have already decided that. Here comes a question. Is Chrome really the best browser to use in your opinion, James?
I never use Chrome. I don't know. I mean, it goes back to, here's the thing. At one point, Internet Explorer was the basic one everybody had. Your grandma uses it. And so hackers were like, 100%, I'm going to go in there and totally steal everybody's information. And Google Chrome was like, we're more secure than that, so we'll protect you. And it's great. That's good. You can still get hacked. Firefox used to be, they're like, we're not even proprietary. You have to please, give us a donation of $2 because Firefox is so much better. And everybody's got their own stuff. There's so many different there, and I don't even know how many other browsers that you could possibly. Safari now. What is it? I said it in the beginning, but now it's Microsoft Edge. There are all the ones you can use. If you're worried about security, the best thing to do is actually invest in a virtual private network. So if you can invest in a virtual private network, then you're encrypting your internet connection, and that's going to be the best way to go, as opposed to your browser. I will say that a lot of programs don't like Safari. They don't like whatever because they have a connection. Microsoft Teams is going to use Microsoft Edge. They're going to design their program to work well with Microsoft features. So that's another consideration. If you're using Google Meet, use Google Chrome. Like, don't connect on some other ways because they're just going to talk to each other better.
That makes a lot of sense. And I think that goes along this next question. What platform is best for interpretation when the interpreter is remote and the clients are present in a informative meeting?
And so everybody is in person and just the interpreter is remote?
That's what it sounds like.
Yeah, okay. So have backup plans on backup plans. So let me tell you, I had a really cool experience. I was interpreting for a job interview. I was connected to the patient's phone. That phone was placed next to a laptop. The laptop is how they were video connecting with the company that they were interviewing with, right? So we tested it out ahead of time. We made sure it works. But that was the thing. We tested it out ahead of time. And we made sure to pull up the audio and say, if I speak clearly, does your laptop pick up the sound from the phone clearly enough? And it turns out that, yeah, during the interview, everything went perfectly fine. So a speakerphone, conference phone in the center of the room and being an over-the-phone interpreter might be the best avenue to go with in that sense. Have your script. Are you going to be able to pause at any one moment, or is that sound going to be distracting? Can they have a handset? So you're connecting to the conference phone in the room, but whoever needs the interpretation is just on the handset. And then when they need to speak and they say, they can put it on speaker. They'll say their comment, you would be able to interpret from the conference phone, off speaker, and back onto your headset. Get creative in terms of all the little nuances and on buttons you can push to be able to make it work in that situation.
This is wonderful information, James. This is such a good question because, again, I'm an interpreter myself, and we hear this a lot, okay? Is the interpreter's role to help service providers or patients to be correctly connected or troubleshooting? I was told as an interpreter, my job is only for interpretation, nothing else.
So as Analia was mentioning, I'm a trainer of trainers for the Community Interpreter National. And if you haven't taken the TCI, take the TCI, shameless plug. It's a phenomenal just training session. But it goes back, so, oh man, we only have 2 minutes left. It goes back to the model that we're following. And when we are community interpreters, we want to just interpret. We do. We absolutely want to just interpret. But in the sign language field, what we're saying is role is not actually something that you take on. Role is something that you engage in. The interpreter is present. The interpreter is an active participant in creating what is happening. And when there's a barrier to communication happening, and you as the interpreter identify that, and you as the interpreter have the answer to make it just go smoothly, I see no reason why we have to say, no, I'm just the interpreter, because what are the consequences? They could say, no, I give up. We're just going to use this kid. They've got a kid in the room. I'm tired of dealing with this phone. I'm just going to use their kid. I don't want that to happen. No, if you know, forget it. I'm just going to hang up. We're going to write back and forth. I don't want that to happen as the interpreter. No, forget it. We're not going to use the interpreter anymore. I'm not going to use an interpreter anymore. No, we can't use it. No, I'm not going to call an interpreter because the appointment is just so frustrating. The consequences are so bad if they continue to have these bad conversations that I'm going to step in. I'm going to help address a barrier, and then they can have a conversation and I can interpret again.
Wow, James, people are just asking for your email again. So if you can just put it on the chat one more time.
Sure,
so
sure.
Ladies and gentlemen, everybody joining us today, James is going to be one of our TOT for the TCII coming in the fall. And as you see, he's phenomenal. So I hope that you can join us. Again, James, I know time is up. You have been phenomenal. Thank you so much for your insights, for your knowledge, for your wisdom. You're so easy to follow, to just feel connected with. Thank you very much. And just for the audience, as always here at Cross Cultural Communications, my colleague Andrew, he's the ghost today, okay? You can see my face, but he's a ghost, but he's there, okay? We will stay on the webinar for another maybe 10, 15 minutes to answer any questions that you may have about us, Blue Horizon, any of our programs. Again, meanwhile, James, thank you so much again. We have loved the presentation and we'll see you soon.
Yeah,
it's just around the corner.
Woohoo! Yeah, my pleasure. My pleasure. Absolutely. I love this. Maybe I can come back with a different topic or something else as needed. But I've got to run because I have a virtual visit to connect to very soon. So I'm going to get back to that. Thank you.
Best of luck to you, James.
All right. Thank you, everybody.
Bye.
Bye-bye.